Thanks, Marie. Good afternoon, everybody, and welcome to my decision day this afternoon. That was my computer saying it was 3 o'clock. And just one decision today, but starting at the top of the agenda, do we have any deputations?
No, I can confirm we haven't had any requests to speak for this meeting.
Right, good, thank you. Moving on then to agenda item 1, Serious Violence Reduction Grant. Are you going to take us through this paper, Simon?
I'll start off, and I think Julia will give any detail that we require. So good afternoon, Chair and colleagues. So this report is to request approval for a grant of £36,744 pounds in line with our Violence Reduction Unit funds, which we get from the Home Office via the Office of the Police and Crime Commissioner to tackle violence across Hampshire. And this programme is a programme working with the emergency departments in Winchester and Basingstoke hospitals. Julia, do you want to take through a few more details of the programme?
Yes, sure. It is part of the Violence Reduction Unit budget from the Home Office. So there has been some delay simply because of COVID this year. So it's something that we're looking to expand from the University Southampton Hospital model and the learning that's taken place to date, which their programme started in March 2020. So there's a lot of learning that they've taken from that, and they have embedded their work really very well and had very good feedback from the clinicians that they've worked with. As part of their work is also training up the clinicians themselves, which is what we'd be looking to do. But the majority of the work is about providing that teachable, reachable moments at that point of change for the young person. So it's targeting young people who are in emergency departments because they have been involved in violence, but also because of their mental health as well, and substance misuse and alcohol. So it's a sort of considered like an adversity related event, and there's a very high risk of them returning and being readmitted, and there's also obviously a very high chance of death as well in that population. So it's really about trying to reduce the chances of returning to emergency departments, but also to enable them to have the skills and the services to access so that they can turn their lives around, if you like, and not be at risk going forward. Obviously, substance misuse and mental health do seriously increase chances of serious violence. So it's something that is key in this setting, and has been trialled since 2006 by another provider in London South East, as well as in Manchester and Birmingham, which are big areas for serious violence. So it's something that we're looking to start as soon as possible. There's quite a lot of focus on this work nationally, and there's workshops, best practice showcase workshops coming up again as well to cover this. So it's an area, like I say, has had quite a lot of learning in Southampton. It's also now COVID secure in its provision, having taken the learning, and it's something that we are refining the performance of indicators on regarding looking at reducing reattendance in emergency admissions, and looking at reducing risks around mental health, substance misuse and violence, but also ensuring that staff are trained and are continuing to give positive feedback in the Basingstoke and Winchester settings, in addition to the Southampton ones. And then we would review in September in order to consider taking it forward and making it a more, and also discussions are in place already to make it a sustainable model with our CCG counterparts.
Okay. Thanks, Julia. Councillor Huckstep and Councillor Keys, do you have any comments or questions?
I don't have any questions, Madam Chairman. This is another example of a great initiative which certainly should happen. One of the delights of these decision days, both public health and social services, is that we get to as it were, approve grants to make people's lives better. And the bonus is that they're often spent to save measures as well. because they stop things happening downstream. The sad thing is we don't have any accountancy discipline which is able to show us exactly what the savings might be. We just know that they happen somehow. So I'm in full support of this this grant. Thank you.
Thank you. Simon, you want to come in there?
I think, and Dave may have a slightly another view on this, but I think you're absolutely right, Councillor Huxley. One of the challenges is kind of investing and making clear the pounds saved. So what we can do is shows the benefit and we know the evidence, but then actually turn that into pounds is quite challenging. But we do need to work very closely with the hospital to make sure that they do record those things really carefully, so we look at reduced admissions and also as we upskill some of the staff, that should hopefully make a difference on the long term. But you're right, it's very challenging at times to measure that in a financial way.
Anybody else? Just one question. Beyond the reachable, teachable moment, how many people, young people, are actually engaging with the system to make changes and
I haven't got these numbers sorry to hand. Just see if I can get those. Sorry, I haven't got those to hand at the moment.
That's right. That's
well,
all right.
we know the number of people who are coming in for emergency admissions for injury, and we know in the paragraph 13 just kind of set out some of those percentages, and what we'll do is make sure we've got a good baseline to follow that up and monitor that over time so that we can be clear. So A&E recording is notoriously complicated, so we'll just be working with the A&E to make sure it's all recorded carefully so we can bring back an evaluation report perhaps at one of our meetings, Councillor Grayski.
Yeah, fine. No, thanks very much. Thank you. Right.
On a slightly frivolous note, Madam Chairman, I am intrigued by the fact that this grant has been calculated down to £1 in whatever it is, 37,744, an extraordinarily accurate figure. Why isn't it sort of 38k or 40k?
Because it's public money and we have to account for every single pound.
Penny, yes.
Yes, yes, I think is the answer. Okay, well, I'd just like to say that anything we can do to reduce the risk of serious violence, prevent suicide and address underlying serious mental health issues and substance misuse among young people has to be a good thing. And I'll say it again because I like it. I think the phrase reachable, teachable moments is very appropriate. It's also clear from the report that No Limits have a proven track record of delivering a similar service at University Hospital in Southampton with evidence-based positive outcomes. So I'm happy to approve the funding of £36,744 as in the recommendation at paragraph 2.
Okay, thank you.
No, that's good. Anything else? In that case, I'll call the meeting closed at, oh dear, sorry, 9 minutes past 3. Thank you.
Thank you.
Thanks very much.